Hey guys, how you doing? This is episode 34 of the Lifeshot Podcast. I interviewed Dr. Warren Jordan. He's a chiropractor from Durban, South Africa. And I had such a great, amazing conversation with him because I put my back out recently and I was wondering what is it that caused me to herniated disc while I was playing touch rugby. And he gave me such great advice, and I really hope that what you hear today is going to help you also to live your best life now by looking after yourself in ways in which Dr. Warren has suggested in this podcast. Number 34 of the Lifeshot Podcast. I hope you enjoy.
Well, first of all, posture has got nothing to do with that. A lot of people sort of think posture, shoulders back, chest up, chin down. That's got nothing to do with posture. Yes, the army might have expected you to do that, but that's got nothing to do with posture. One of the major issues that leads to dysfunction body-wide is weak core stability. I think the biggest pattern I see in the 30s and 40-year-olds is they think they're still 21.
Yeah, that's me.
I believe age is a bit of a cop-out. You know, a lot of people use age and say, well, I'm old. But it doesn't have to have as much of an effect as you are allowing it. I think one of the questions you had that you sent me is, what do I see most come through my door?
Yeah.
And the simple answer is this: I see stress walking through my door.
Hey, yo! It's the Lifeshot Podcast. Change your world and change the world.
Jordan, welcome to Lifeshot Podcast. How are you doing today in South Africa?
I'm doing good. How are you doing?
Good, man. We got a bit of sunshine here, so I can't complain. But although it has been a bit of a storm, Ciara, I think they called it. So my fence blew down. Not too happy about that.
That's not helpful.
What can you do, eh? So we're going to talk to you today because I used to use chiropractors a lot when I was in South Africa, and I've actually never seen a chiropractor down here. And there's a few. The reason I want to talk to you is because I hurt my back playing touch rugby, and it really kind of annoys me that maybe it's because of age or whatever it is, but it annoys me a little bit that it's why does it have to do that? Why does my back have to hurt, right? So I'll tell you the story, and I asked you this. I gave you the questions beforehand, and I think this is a good thing because I wanted you to think about, maybe there's no specific answer for this, but I was playing touch rugby and I was drop kicking the ball, and then I felt a little twinge. 2 weeks later, I went down to get the ball, and I thinking I'm still young and fit and I can run fast and everyone's always impressed with my speed. I jumped up off of the floor like that, and then as I did, I was like, oh, man, that hurt. And I was like, okay, guys, sorry, I'm gonna go home now. And that was it. And I was like, what is that? Is it my age? Is it my diet? Is it lack of mobility? So I just wanted to see what you think about that situation. Is it a common thing, maybe?
Yes, it is common. As for the why, it can be all of those things you mentioned. Is it age? Yes, very much an age-related thing. Is it a bad posture, bad position? Very much so. Is it a weakness or an instability thing? Yes, very much so. What specifically for each individual person, that can vary. So, it's not something that I can tell you directly and say, well, it's because you sit badly and haven't been doing enough crunches recently, so you're weak and that's why. And now hitting closer to 40, shame, you're just getting too old. So who knows? It's there's no hard and fast for each person. It's this plus this plus this plus this.
Yeah, I suppose it's individual body types and what you've been going through. It's not just one thing. It's like it's a build up of certain things, and maybe also it might also just be that no matter who it was, but majority of people, if they did what I did, even if they were younger, that might have happened as well. So it might have just been that movement or that pressure. So what is it around that when people think about the slip disc, can you explain what that is in terms of the mechanics of what's actually happening?
See, a slip disc is a bit of a layman's term or a colloquial term that is often thrown around, maybe inaccurately. A prolapse disc or a slip disc accurately is where in a vertebra, and I actually have a little vertebra here.
Yeah.
Now, if you look inside that vertebra, you got a little pink center. Now, that's the inner gel-like, what we call the nucleus pulposus, and then you got the outer fibrous layer, which is called the annulus fibrosus. Now, a slip disc is when there is a microfracture in the outer fibrous layer, and this inside stuff pushes its way out and creates a little bubble of that stuff sticking out. Now, that can happen going forwards, because this is the front of the vertebra. That's the front. These things are the back. Now, if it goes forwards, it generally doesn't cause a problem. But if it goes backwards, it can start impinging or pressing on the nervous structures that are around your spinal cord and the nerves that stick out the side. So I've actually got a little one here that shows a little disc prolapse. So you can see straight away that little pink bit is now pushing out towards the back. Now, technically, that is what we know as a prolapse disc or a slip disc. This is quite problematic. More so dependent on where this extension ends up. Because if it ends up more specifically towards one side or another, it can actually compress on these little nerves that's sticking out the side. If it goes centrally out the back, it actually presses on the spinal cord. But funny enough, in a lot of people that have MRIs for other things, often they have a prolapse disc picked up as what we call an incidental finding. In other words, it was just they happened to find one. They are asymptomatic. They've had no problems. They might be fit as a fiddle or as lazy as anything, but they've just picked up that they've got a prolapse disc. So a prolapse disc doesn't have to be symptomatic. It doesn't have to be causing you a problem, but it is an indicator that something's not great. So it is good to then, explore it and find out what might be the problem. For you, what you described, dependent on what other things you were presenting with, you just described a twinge of pain in your back. You really were sore, but I never heard you mention anything about any sort of radiating pain. I had pain into my hips, into my foot, into my leg. I felt this burning sensation. My foot went numb. There's all these sorts of symptoms we try and hear and listen for that give us an indicator to say, well, it could be pressing on that structure or on that structure. And based on that, we then would worry about what we call nerve impingement or nerve entrapment. And all of those things can ultimately become a much greater problem.
Yeah, gee, no, I didn't have any of that. So it's good for our listeners to know that there's so many different things that could be pressing on, which would cause problems, further down or further up. So is it a good time to see a chiropractor or somebody in your profession when you do have one of these? Even if like me knowing that it was that, or you just explained with that spinal thingy, is it a good time to see somebody like yourself at that point? How can you help a person like me?
Is it a good time? Yes, it's a good time. What would have been better would have been to have built up a relationship and a maintenance approach where you are seeing, whether it be a physiotherapist or a massage therapist or a chiropractor or some combination of those manual therapists on some form of a regular time frame, so that you can rule out, well, it's just a muscle strain, or it's just a this, or it's just a that, because those things are being managed. Or if you are being managed, when you go back, the person already knows, well, you do have a weakness in this area. Let's just check that, make sure that's not the problem before we start freaking out and thinking, oh, wow, we think there's this problem. We need to send you off for hospitalization and surgery and all the rest, when it could just be, well, you just strained the muscles around your back. So from that perspective, yes, the minute you hurt yourself, go see someone. One step better would have been, actually, you should have been seeing someone on some degree already, so that you were looking after yourself, maintaining yourself in a better way.
Okay, so that's a good point. So prevention, perhaps. Talk to us about maybe about some of your clients who you think are like the model clients, looking after themselves, preventing, and what is it about them? Why do they do that?
Okay, well, just off the top of my head, I've got a few patients. Unfortunately, good patients tend to be less common than we'd like. Most people, life is busy, life is demanding, kids, work, stresses are demanding. So to get in regularly, people will brush themselves aside and they'll say, well, I need to get this assignment done, or I need to get this report done, or I've got to get to that meeting, or I've got to get the kids to school, or whatever. And they will choose those things over themselves, and they'll wait until they are falling apart and now they can't manage anymore. Then they'll have really sunk much lower to the point where now we got a lot more work to get them back up to what they were. But in terms of good patients, I have had quite a few good patients in the past, some better than others. I had an American client. He was great fun. And he'd been seeing a chiropractor since he was about 3 years old. And when I treated him and he was here, it was in his mid to late 40s. And he would literally walk in very happy, very jovial. And I'll be like, well, how are you? Oh, good. And everything's great and wonderful. So I said, well, then why are you here? I just don't feel right. Something's not quite right. So there was no real pain. There was no real dysfunction. He was quite active, did a lot of swimming and a lot of almost triathlete types training. And he could just feel something wasn't right. And because he could feel something wasn't quite right, he chose to rather address it then before it declined further into what we would call a dysfunction, where the muscles would be now in spasm and he'd be limping or in pain, all the rest. And that was great because he knew his body so well and he knew what treatments he would respond to, that he would seek them out before the problem hit. That way he knew he would go for that much longer. And he would literally, I wouldn't see him for months on end. And next thing I just see him there and he'd walk in and I could literally bet money on how he'd walk in, happy, everything's fine, just a small niggle and deal with it and he's out the door. So that was he was a great example of someone who just understood maintenance. Then I've got other patients where for them maintenance has become a lifestyle thing where I've got a lady patient. I know we were talking about guys a bit, but I have a lady patient who suffers with chronic migraines. And through my treatments with her and dealing with the migraines, we've addressed health, we've addressed weight, we've addressed lower back issues, we've addressed psychological, emotional issues, all of which have brought her to a greater degree of health. Where does she still have a migraine periodically? Yes. She knows how to deal with them better. She's not so emotionally affected by them. She literally comes in and again also comes in incredibly happy to see me. I suppose I'm a happy looking guy, but it's more the fact she knows that she's going to just feel that much better by the end of the treatment. But she's not just seeing me, she's doing all the other steps that she's been advised to do. So when you have someone who's cottoned onto the idea that a maintenance approach is just going to help them function better for longer with less interruption from injury, they do just feel better. It's the people who let themselves fall apart and then they walk in and they literally bent over double and say, well, how long have you been like this? Oh, no, it's been 6 months.
Oh, well.
So why did it come? Oh, no, I thought it would go away. Oh, no, my mom gave me some anti-inflammatories. I tried this person and then it didn't work. I tried that person and nothing happened. And then I gave up for a few months. And so people do tend to wait too long to do something.
Okay. So
unfortunately, when you ask about patients, that tends to be more the rule than not, is that they wait too long. Unfortunately for my patients is they get me in their ear as soon as they walk in. Where have you been? I remember what I said the last time. And so they, just for fear of getting tongue lashed by me, they in a little bit quicker than maybe they would have somebody else.
Yeah.
So there's a huge importance for just monitoring and looking after yourself a bit better.
Yeah. So when I did live in South Africa, I used chiropractors more, like I mentioned, and because you're a chiropractor, so I suppose the question I want to ask is, do people who are quite active, so let's just talk about, guys who are maybe like myself, who do quite a lot of exercise, but maybe not major, not triathlete stuff, but I'm doing rugby, I'm doing mobilization exercises, strength exercises, a bit of gym. Is it recommended that we consider a chiropractor? Let's say someone's never used a chiropractor in their lives, and they do have like a little niggle in their lower back. Is it worth saying, listen, why don't you consider looking at a chiropractor? I know that because there's a bit of, some people say, chiropractors are no good. You don't need a chiropractor, and you shouldn't be bending your body like that. But what is it structurally, scientifically? Is it a good thing to see a chiropractor?
I'm biased, so of course I'm going to say yes.
Yeah.
But I hear your question. A lot of people do have those questions. They're not sure, and
give us.
My personal approach is a little bit different in that I know overseas in the UK, chiropractors tend to be predominantly just manipulation. So you'll come in, they'll do very little muscle work. They'll literally just loosen you up for a few moments. They'll adjust you, and they'll maybe give you a recommendation to do some exercise therapy, what have you. Whereas personally, I do a lot of muscle work as well. So when it comes to people asking me, should I come see you? I'd say, sure, come see me. Whatever the problem is, I can address. But depending on the relationship you have with the chiro and the chiro you're seeing, it depends. You need both parts of the problem. Very seldomly will you find an issue just to be a bony issue or a joint issue. It also could be the muscles around it, the soft tissue around it. My 12-year-old at the moment is battling with an elbow issue. She's just got a sore elbow. Now, I've treated her elbow. I've loosened up the joints around there and got some things moving. But she's also very inflamed in the tendons and the muscles around her elbow. So if I just adjusted her and didn't release the muscle tension, I'm not going to resolve the issue.
Yeah.
So the question for me is I tend to look at it more holistically and say, yes, see the chiros, because I've had a lot of patients who have seen physio, and not gotten a significant and a long enough lasting recovery or relief from the issue. They've seen me once or twice, and suddenly they're feeling a whole lot easier.
Yeah.
What physio did wrong? No, it just wasn't complete.
Yeah.
So you have to make sure you are covering all your bases. You're hitting all the nails on the head. You're not just addressing only one very small compartmentalized part of a bigger problem.
Yeah, that's like
so.
Life's like
yes,
that, isn't it?
chiros very much have their part to play. Very much so.
Yeah, I think so. And because sometimes we just want to focus on one thing, whereas life is a series of getting things in balance. So we're going to talk about food in a minute, but before we get there, can you give us some tips on correct posture? Like I sit at a desk quite often, and people who are desk workers, what's your advice?
Well, first of all, posture has got nothing to do with that.
Mm-hmm.
A lot of people sort of think posture, shoulders back, chest up, chin down. That's got nothing to do with posture. Yes, the army might have expected you to do that, but that's got nothing to do with posture. Funny enough, I've just finished with a patient just shortly, a little while ago, and I had to work through this with him because he's also a desk worker, very bad posture, very bad core, and all the rest. Yeah. And the reality is one of the major issues that leads to dysfunction body-wide is weak core stability.
Okay. Mm-hmm.
Now, weak core stability has nothing to do with six-pack.
Yeah.
Because I know guys who have got an awesome six-pack who have got a shockingly weak core, and I know guys who have what we call here a keg, a beer belly, and actually they're a lot stronger than some other guys. So it's really nothing to do with the aesthetics of what you look like. It's more to do with the function of what those muscles are doing. Okay. Your core is not just the front tummy muscles, the six-pack as I described just now. It's really got to do with all the muscles that's sort of from below your chest to above your pelvis, front, back, and sides. And how all those muscles work together to, we think of core and we think of corset. And you think how the corset squeezes in and supports and holds and stabilizes your spine.
Mm-hmm.
And the minute you engage that and do that correctly, so if I'm in a slouched position and I engage my core, naturally I just sit up straight.
Yeah.
Nothing, my shoulders are relaxed. A lot of people say, but my shoulders hurt when I do that. Well, that's because you're not supposed to be using your shoulders to improve posture.
Yeah.
A lot of people talk about your head being too far forward. Well, yeah, if you really have got very bad forward head position, you may need to work on that a bit. But a slight anterior head tilt doesn't really mean your posture is shocking. It just gives you a little bit of a focus to work on. Predominantly, posture comes from your core.
Mm-hmm. That's brilliant. I feel like I just want to jump through the screen right now and just come lay on that bed and get myself sorted, because I just feel my back just needs a bit of a. So, anyway, supplements. I know you used to be a fitness trainer, didn't you? Are you still doing fitness training?
Yeah.
Okay, so
I don't do fitness training anymore, but I do a lot of rehab and advice. I do my own training for myself, and I end up teaching people the whole time anyway. So in practice and privately. So
yeah.
I'm not doing it, but I'm doing it.
You just can't help yourself, Warren. You're like, you got to do it this way, or you got to do it that way. Probably, I can just see it.
Yeah.
Okay. What supplements do you suggest taking for everyday people who have maybe is it bone density? Maybe they need to make a bit stronger.
Yeah. Look. When it comes to supplements, the main thing that people make the mistake of is they think, okay, well, I'll go get a multivitamin.
Mm-hmm.
And unfortunately, multivitamins are not the right option, because of that whole list of things that are on there, your body's probably only utilizing a very small percentage of them.
Yeah.
I'm more likely to say, well, possibly go get some tests done and actually look at what your symptoms are. Okay, I'm lethargic, I'm tired, I'm this, I'm that. I really need to up my B12s. I need to do this. I need to folic acid. There's a whole lot of these different things that you might need. And just hitting a multivit is not really going to do that. In terms of what I tend to recommend almost on a daily basis, I recommend two things. The first one is your omega-3 fatty acids.
Okay.
Now, most people will know that those omega oils, your fish oils, are really good for you. And they're great for your brain. They're good for your body. They're just amazing. They're incredibly good for you. And you can get them from fish oils. You can get them from flaxseed. You can get them from a few different options. Now, one of the benefits that I specifically say omega-3 is because what we found is that omega-3 tends to be a little bit more anti-inflammatory.
Right. Yeah.
So rather than going to the chemist or the pharmacist and getting an over-the-counter anti-inflammatory, rather get something that, okay, it may not smash it on the head quickly, and then also have the knock-on effect of maybe putting strain on your liver and your stomach lining and what have you. Yeah. Rather have something on a daily basis that's going to just naturally keep you in a much stronger state of wellness, both by improving inflammatory markers, but also improving things like your joints, your muscle function, and what have you.
I love that.
But the second thing that you spoke about in terms of bone density. Now, bone density tends to be a lady issue more often than not. I'm sorry, ladies. Really, it's not like that. Not great, but it does tend to be a lady issue. Your bone density for a lady tends to grow and grow and grow, so that at the age of about 35, and after that, it starts to decline again. The way they improve their bone density just naturally is obviously great diet, but weight-bearing, load-bearing exercises. So the ladies hate hearing this, but they've got to get into the gym. They've got to do weight-bearing exercises. They're not going to end up like big, bulky Arnold Schwarzeneggers, but they've got to pick up a weight or two. Unfortunately, walking and riding a bike and doing jump, sugar lump, in the cardio class is not really going to get as much of an effect as they need from that. But to aid that is to find a really good calcium supplement.
Okay.
Now, the problem with calcium is that a lot of companies source their calcium from an inorganic substance called dolomite, which is basically a big rock that they crush down and they pack it into a little pill and say, right, take that. The problem with the dolomite source thing, and again, I'm happy to be corrected by this. Just a bit of research that I've had and just found personally is that it doesn't get as well absorbed by the body. What we talk about bioavailability. The alternative is there are a few brands where they've been able to tweak that bioavailability depending on where they source the calcium from. There is a brand which I'm not promoting, so I'm not going to say their name. But there's a few brands out there that actually source their calcium from organic plants, and they actually extract the calcium from the plants, which straight away boosts the availability from maybe 15 to 20% up to 75, 80%.
Wow. So
straight away, your body will be more likely to absorb and utilize that calcium as opposed to just letting it pass through. So that's the calcium is an amazing thing. Another one that works coincidingly with calcium is magnesium. Now you do get supplements where you get them combined, like some sort of a CalMag, calcium magnesium composite. And why they do that is calcium and magnesium are both very good for reducing muscle tension. So they actually reduce muscle activity to a degree. They calm the muscles down a bit. So CalMag's calcium, those are actually they even use. I use them, and my wife, who was on a while ago, uses it for people who battle with sleep. So it actually helps them to relax to the state that they are able to sleep. So if they're insomniac or battle to sleep, that's an option. If they're battling with a lot of muscle tension, they can take that sort of stuff, and it helps to reduce that. It's not a cure. It's not going to take it away completely. It's why you do need the additional manual therapy to help. But it is going to be an additional add-on that's going to hopefully steer you away from relying on the anti-inflammatories, the NSAIDs, the painkillers, and what have you that might be there. One other something that I also recommend, it's not necessarily a supplement, but it's something called Epsom salts. Now, Epsom salts is an old wives' tale. Take Epsom salts, sort this out, sort that out. But what Epsom salts, which is actually magnesium sulfate, is amazing anti-inflammatory and muscle relaxant if you bath in it. So if you get just raw Epsom salts and you actually throw some bicarb into that, bicarbonate of soda, and you put a cup or two into a standard size bath, soak in that for 20, 30 minutes, it actually helps to reduce that muscle inflammation and relax those muscles incredibly well. And that's just another example.
Salt? Is that also the same thing?
Can help you. Sorry?
Himalayan salt, is that similar to Epsom salt?
No, Himalayan salt is Himalayan salt. Epsom salt is different.
Okay. Right,
Although that I've also heard that Himalayan salt also has incredible properties, but I don't see myself bathing in Himalayan salt.
What about bathing in milk?
No.
Not recommended. Okay, so we spoke. That was good information. I love that. So you're talking about calcium, magnesium, Epsom salts, omega-3s, really good for that. And it's about people looking after that, the inflammatory things that might be happening. So if we just jump over to food quickly, food, obviously certain foods will inflame people. And you can feel free to answer this or not, but what do you recommend as a diet? Maybe not that a certain type diets, but just food types. What do you recommend?
I've got many people who will probably fight me on this a bit. I tend to be a little bit more on the moderate side of when it comes to diets. I don't like telling people you must deprive yourself of this, and this. Because I haven't come to the full reality or belief that something is completely bad for you. So there's a lot of people that are pushing towards plant-based diets predominantly, and there is so much evidence that says this is, and it's incredible. The evidence is amazing, but within that evidence, it doesn't say that they're telling you animal protein is going to have a problem for you. But is there possibly just also a quality of protein and quantity of protein. So I'm a bit cautious of saying, well, this is bad for you, this is bad for you, but there's a few things I will definitely point at. Sugar. Sugar is nasty. It causes a whole lot of problems, and I hate myself for saying this because I am a sweet tooth bar none. I love my sweet stuff, but I know it when I've had it, my body just crashes and I feel really not great for a while after. I'm definitely seeing a huge link with things like gluten sensitivity, gluten intolerances. So that's more your wheat-based stuff. Again, only but predominantly. That tends to be quite a common one. And in fact, the articles I've read and the webinars I've partook in is they've actually shown that gluten, even if you're not sensitive and you're not intolerant, they've actually shown that gluten is still not great for you. So you should try to, as much as possible, limit that sort of stuff. The other one is pretty much anything processed is not ideal. Again, it's not going to kill you if you're having some processed food once in a while. It's when it becomes the lifestyle of convenience. It's just easier to throw that all together and get it done and go for it, rather than having something that took a bit of love and compassion and care to prepare and make from scratch. I tend to be more on that side. There's definitely, like I said, a lot of evidence to show that your plant-based diet is incredibly good for you, and it's something that if you are considering it, or even if you're not considering it, you should look into it. And just to, it's not about giving a rap on the knuckles and say, right, stop killing cows, but it's more about just saying, there might be a slightly better way of doing this. Consider starting with maybe a 1 day a week veggie day. But I think when it comes to diets, the best advice I could ever give you would be conscious and aware of your body, and notice what happens to your body when you do XYZ. So if you notice that you had a cheat night and you indulged in some yummy chocolate ice cream and chocolate brownies or something, and the next day you just felt terrible, your joints were sore, your muscles were sore, and everything else was sore, it's very likely there might be a dairy issue, there might be a gluten issue, there might be a sugar overload. And if you just say, well, I'm tired, it's Monday morning, I'm grumpy, you are giving yourself a problem, because you're ignoring the reality that your body actually might not be processing these things well, and you're just causing yourself unnecessary issues. So when it comes to diet, that tends to be more my advice. Is just be aware of how your body feels and processes things, and then adjusts accordingly.
That's brilliant. I love that, Warren, because that being aware of your body is probably the first step in taking control of your health. So just eating something, not feeling guilty about it, just do it, but just notice afterwards what that does for your body. And I suppose another tip for eating well is to have a wife like yours, and the listeners will know Claudette, who I interviewed on the show, because she's making some nice sweet desserts for you, I'm sure, which are healthy, and that's always a good thing, isn't it?
Yeah, it is. It's a big help. It is a big help when the family sort of all try to be on the same sort of wavelength.
No, that's brilliant. So I got two more things for you, and I want to ask. So we've spoken a lot about core. So get your core sorted. You don't have to have a six-pack, but at least make it stronger. We spoke about vitamins and supplements, which is really good, and the diet. You don't have to go vegan, but try eat less meat maybe, or maybe you're overloading on protein, but also be aware of your body, etc. But as a chiropractor, and you see clients every day, what is it that really, as men, what would your advice be? What are the things that we're doing, and it could be any of those you could repeat, whatever it is, that you think guys, please just stop doing that. You're causing yourself problems. Is there something that is a pattern in guys, especially in the 30s and 40s, that you see happening?
I think the biggest pattern I see in the 30s and 40-year-olds is they think they're still 21.
Yeah, that's miss me.
And that tends to be more the case. So they do. They think they can do what they did when they're 21. They think they can. Okay, if they so inclined, they can spend the whole night out doing whatever they're doing, and then be up first thing in the morning and be fit as a fiddle to do whatever. And their bodies are just not that way designed to manage anymore. They are. I don't ever ask a patient how old they are. I always ask them, how young are you? Because I believe age is a bit of a cop-out. A lot of people use age and say, well, I'm old. Yeah, okay, age certainly has an effect, but it doesn't have to have as much of an effect as you are allowing it. But it just means you need to do certain things better. You asked about the guys. The first thing I tell guys is they need to look after their health. They're not indestructible. They've actually got to think about their sleep, their eating, their overall health, exercise. Unfortunately, guys, we naturally take on the pressures of husband, provider, father. We try and be the leaders. We try and take on as much pressure as we can to make everything run, until ultimately that pressure crushes us and we fall apart. And that is the worst thing you can do for yourself. I think one of the questions you had that you sent me is, what do I see most come through my door? And the simple answer is this: I see stress walking through my door.
Oh, man.
Stress is by far one of the biggest causes or contributing factors to every single issue that walks through my door is stress. So for the guys, they've got to start looking after their health. They've got to be proactive in looking after it. It is not unmanly. I'm not a god if I have to ask for help. If I need to look after myself, it's not a sign of weakness. So, I spoke about maintenance earlier, guys. We spoke about chiros and things, but massage. I recommend massage to 100% of my patients.
Really?
Massage is not a luxury. For me, massage is not a luxury. Going to the fanciest spa for little cappuccino drinks and a bunch of grapes, that's a luxury. But finding someone who a real good beat down, nice deep sports massage that's not going to break the bank, that is necessity first and foremost. So, but people are not prepared to allow themselves that, because they still have this feeling, well, then I'm splurging, I'm indulging myself, when that's not what it is. So you've got to look after your health. Fitness. I love gym. I love exercise. I love weightlifting. Yeah. It's what I'm not a runner. Do you run? No one's chasing me. I'm not running. But I love exercise. Why? Because it gets my heart rate up. Yeah. I just love being able to move big weights around. It fills me. I really enjoy it. But when it comes to exercise, a lot of guys still have this tendency to want to be big and bulky. Yeah. The reality is never in your life, as you get over 30 or 40, are you going to need all this bulk and mass and size. You've just got to be physically strong enough to move yourself. Yeah. So I really tend to send guys more on the side of functional training. And please hear me carefully. When I say CrossFit, CrossFit is a good type of exercise because it is functional training, and there's a lot of multi-muscle movements that they call on. My biggest reservation when it comes to CrossFit, especially someone starting, is because there's such a high intensity. There is a very high incidence of injuries from CrossFit. Sure. So it's not something I would just recommend to anybody. Something that I do find works incredibly well, but you've got to find an awesome trainer, is kettlebell. Kettlebell incredible.
Kettlebell.
But like, just for me, just by doing weights that require you to stand and move around as opposed to sit on a machine and push some machine, arms around. That's not going to do it for me. You've got to be able to actually pick up something, use your whole body to pick it up, be able to stand up straight, move it around so that your whole body is moving. And that way, you're actually activating and waking up your whole body. So for me, for the guys, it is, don't be afraid to go and get help. Look after your health. And when you train, just use your whole body. So that's the sort of stuff that I tend to tell the guys a lot more to do.
Warren, honestly, I'm so excited. What you said today is just, for me, bang on. You know what I mean? It's like, I totally agree with everything you're saying. And there might be people out there who are like, oh, I've never heard that before, and I'm not too sure about that. But yeah, I mean, just take what you can from today's talk with Dr. Warren Jordan, and really just think about it. I think it's good advice, really good advice. And it's been so good talking to you. And I just want to promote your services down there in Durban, South Africa, or in the surrounding area. Could you just tell people how to get hold of you and how they can contact you?
Probably the easiest way is they can call my offices on 031 303 3874. That's the landline number. But it's very centrally located in Durban and Morningside, down here by close to the stadium. But yeah, they more than welcome. I'm sure Clint can just put my email address there, and they can just drop me a message. I'm happy to answer questions. I love helping people. I love answering questions.
Cool.
Unfortunately, I can't diagnose you over a phone or via an email because I don't have hands reaching through the computer screen.
Sure.
But yeah, if you have questions, I love helping people and just giving some advice. So I'm happy to answer any questions people may have.
That's brilliant. And I think, just you talking to us today is, I'm sure for some people have kind of like created a bond with you and sort of seen you and can say, hey, I trust this guy. And so chiropractors are there to help. And I think that it's something that people should consider, especially in keeping up and looking after yourself and all that. And so, Dr. Warren Jordan, it's really been great to have you on the show. And definitely I'll put all the details in the description of the show. And I wish you a good week further.
Thanks a million, bud.
All righty. See you then.